Good morning. How is everyone doing today? Thank you all. Thank you all for being here. I am Rachel Reinhardt, the Associate Vice President for Communications here at the University of Arizona Health Sciences. I'm thrilled to be talking today here with Dr. Michael Dake, who currently serves as the Senior Vice President of Health Sciences here at the university and is a medical pioneer in cardiothoracic surgery, specifically imaging technology. And Dr. Deepta Bhattacharya, researcher and professor of immunology at the University of Arizona College of Medicine, Tucson, who many of you know as a prominent voice who helped us all understand how the COVID-19 mRNA vaccines work. Your work is incredible and very inspiring. Welcome. Thank you so much for being here. So today we are not going to talk about what you have done, but instead where you see the future of medicine going. Dr. Dake, you have said that the most effective defense against disease is the body's own immune system. Can you tell us more about that?
Yeah, I think it's clear that when the immune system functions normally, it maintains homeostasis, it prevents tissue injury, and it keeps us well. And when things go wrong, things go wrong. The immune system is extremely powerful in keeping us healthy. And obviously, it affects every organ in the body. And so in that way, it has sort of a universal appeal. And I think that the immune system also is becoming increasingly important as we sort of understand the role of inflammation in disease. I think in the past, we've sort of seen disease as being a single disease, and it comes from just one etiology. But in fact, that's been a little, I think, not really transformative for us to think in that way, because now we know that a lot of different ways can get to diseases, and we have to sort of open up. And I think that's where AI can help in precision medicine and immune-mediated effects on disease, where the immune system is clearly right there front and center with everything that happens.
That's great. Thank you.
I think one of my favorite, this is wonky piece here, but one of my favorite things that I've read in the past is this perspective by a scientist named Steve Hedrick at UCSD. And he was one of the pioneers who actually cloned what's called the T-cell receptor, which is one of the ways in which the T-cell recognizes when something's going wrong inside of a cell. And the perspective was basically something like a view from below and 500 years of misery caused by the adaptive immune system. And I think it's just sort of it's an interesting way to think about it, because, you know, when you think about trees or other long-lived organisms like that, you actually don't have an adaptive immune system. And in some ways, the adaptive immune system has caused us some troubles with things like autoimmunity, at the same time, obviously, being absolutely essential for protecting us as well. And I think what we have is sort of an opportunity to now sort of take the reins back and then use some of the things that we've learned and aiming the adaptive immune system against diseases that maybe you wouldn't otherwise think about.
Wonderful. Well, this dovetails nicely with my next question for you, which is, you know, you've shared that using the body's own immune system to detect, prevent, and eventually treat and even cure disease is transformative and as powerful a tool for medicine as sequencing the human genome has been. Can you talk a little bit more about that?
Well, again, I think the beauty of the immune system is that it's programmable. I mean, you can in theory aim it at whatever you want. And again, sometimes it aims itself at things that you don't really want it aimed at. But I think the thing that I find most captivating about the immune system is that by understanding these basic rules, you can sort of bend those rules or even break them sometimes for the treatment of specific diseases. And so, you know, there are other types of treatments that are sort of locked in and aimed at a particular thing, but the concept of immunotherapy is just so flexible that it gives you many more options of different ways and angles in which you can attack disease.
And that brings me to a point that I wanted to bring, like those of us in the audience wondering, how do these immunotherapies, like how do they differ from the traditional therapies that we're reading about in the news? And will these immunotherapies replace traditional therapy?
That for me? I don't think they're going to replace traditional therapies anytime soon, but this sort of, I think the future is so bright with immunotherapies, and to dovetail on what Deepta said, the immune system is incredibly adaptive intrinsically. But now we can actually, as you said, guide it, program it. And when you saw that CAR T therapy, we're taking cells out of the body, changing them and back. Why not in the future? We don't need to take cells out. Let's just put something in and program it to do what we want to so improve health.
And I think, if I can just make another I guess it's not. I guess the earlier one wasn't really a pop culture reference, but in this case, it is a pop culture reference. In that, for those of you who haven't read the book "Emperor of All Maladies" by Sid Mukherjee, it's really powerful book. Basically, it talks about the history of cancer and its treatment. And when you take that perspective, you recognize just the challenge before us. And now, by digging deep into the mechanisms that cause cancer, you recognize that there's all sorts of things that have to go wrong to cause cancer. And so I think you have to then be able to attack cancer in all sorts of different ways. So I think immunotherapy is a really powerful approach, but I agree fully with Mike is that it's not the only way. The more options we have, the more chances we have to checkmate complex diseases like cancer and autoimmunity.
And I also think that that's why you're seeing all of a sudden combination therapies is now the rule. And not only in mixing and matching traditional therapies, but even in immune therapy, that you can get better results when you attack from different angles.
Wonderful. Now to the Center for Advanced Molecular and Immunological Therapies. So the two of you have worked together to drive the creation of this new center, focused on biological therapies that will either stimulate or suppress the immune system to fight disease. A huge undertaking. Dr. Dake, you've spoken about the fact that you're being in the right place at the right time. Why is this team in the right place at the right time to make this vision a reality?
Well, you both, there are limitations, Rachel, and there are benefits of starting from scratch. And we'll focus only on the benefits. And the benefits are we can make our own blueprint here. And we can focus on what we want to focus on without the legacy of sort of holding us back in certain ways where we don't have that flexibility to go in the directions we want to go that are really the most promising at this time. This is being placed in Phoenix because, quite frankly, that's our population center. This is meant to be a world-class institution, and therefore we need travel, people in and out, et cetera. And as I mentioned, we're focusing on immunotherapies exclusively in a broad spectrum of diseases, including cancer, autoimmune, infectious disease, and also in inflammation. Again, very important, not only with its effect on aging, but effect on many other diseases. And then finally, I think we have a broad cross-cutting category, which is called immune phenotyping or immune monitoring. Certainly when I started, there were T cells and B cells and nothing else. Probably by the time Deepta went to school, there were a few other immune cells. But now, which clearly we're learning more and more about the sophistication, complexity of the immune system and how to manipulate it.
If I can just jump in, and if Mike isn't going to toot his own horn, I'll toot it for him. For me, one of the unique things about being at the University of Arizona really manifested itself during the COVID-19 pandemic. And, it basically required this massive group of people with all sorts of different expertise, things from legal, regulatory, supply chain, clinical testing, and then basic research like my own group, were all sort of integrated together by Mike into this incredibly functional team that led to what I thought was one of the most productive COVID-19 pandemic responses in the entire country. And what I was thinking is that if we can recreate even just a little bit of that magic in the context of CAMI, then we're going to be in good shape.
Excellent. And, specific to the University of Arizona as well, we touched a little bit upon this, but what do you think the unique contribution that this university can make to patient care is? Dr. Dake?
Well, Rachel, that's a big question. I don't want to, be presumptuous to say we're going to make a unique contribution, but I think we have a very collaborative culture that we're working in. Again, Deepta and others down here in Tucson are all they're all in on CAMI and all in on how we can make this a collaborative opportunity for all of Arizona. Obviously, as I mentioned, we're very interested in actually producing our own immunotherapies within CAMI. And that allows for a potential opportunity for phase 1 clinical trials, the very first testing of new, speculative in some regard, but also potential high reward along with risk for patients who may have diseases that have basically failed all other therapies. So that's going to be unique for us. And that we'll have a clinic in the building that will allow patients one-stop shop, drive in a circle drive, get out, have their imaging, have their lab work, essentially get their drugs infused. We're very excited about that. And I think it's going to open up all sorts of possibilities around the area in terms of new startups. Deepta and I were recently in Philadelphia, which right now they consider, Philadelphians, this is their moment for biotech. It's hot as hot. And you can see what happened, all stemming from research work in the university that then spawns out all of these startup countries, entrepreneurial efforts, and the whole city rises economically in terms of not only local taxes, state taxes, but revenue, new jobs. It's an amazing thing. And we're starting, quite frankly, about 20 years behind Philadelphia. But one of our goals is it won't be immediate, but we think certainly within 10 years we'll be right there. And that's what we need here in Arizona.
When we were doing our homework and looking at other institutions that had been, in the recent years had started new immune institutes to study basic immunology, what we recognize is that every institution has its own sets of goals. Some of them are really to support basic science research and focused on that. Some of them are actually on the other end of the spectrum and using these institutes to help doctors make clinical decisions. I think that as Mike was alluding to, one of the emphases that we want CAMI to have here is to have that entrepreneurial spirit. If you look at the route that things you normally take from a basic discovery all the way to a therapy, it almost always involves a step where it goes into a private small startup company, which then gets bought up by a larger biotech company, which gets bought up by a pharmaceutical company. And so we really wanted CAMI to be organized in a way that really incentivizes that process here. And I think that gives us an opportunity to be at least somewhat unique relative to some of the other institutions.
Yeah, as Deepta said, universities are pretty darn good at discovery when it comes to research. But after that, taking that through regulatory processes, taking it out to a sales force, out to actually get a wide swath of the population informed of that's not what universities do very well. So we are very bullish on public-private partnerships, and we hope that that's going to be really a hallmark of CAMI. As Deepta said, we looked at other institutions, and the ones that really caught our attention, these guys are doing well, are organized in that way.
Well, you've said so much I want to follow up on. One point for you, Dr. Bhattacharya, you've spoken about how immunotherapy shows promise for treating a wide range of diseases, including those that are inherited and autoimmune diseases such as type 1 diabetes. And clearly there is a lot of clinical research that's going to be needed to move the field forward. Can you talk to me, though, about why the more basic preclinical research is still needed?
Yeah, I think that to be able to deploy these types of immunotherapies, you have to understand what the driver of the disease is so you can target it. And for some diseases, we actually have a pretty good handle on it. Type 1 diabetes is one. But for other diseases, it's a little bit less clear. Lupus is a much more complicated autoimmune disease. And so being able to surgically target what is causing the disease is hard when you don't know what's causing the disease. And so I think therein really lies this opportunity for basic research. And sometimes it can be hard to justify why you're doing something that isn't going to lead to an immediate clinical translation. But it's that basic research that feeds the pipeline for things decades into the future. And so I think it's just so important to have this broad base of basic research and really support that line of investigation, because eventually some of that is going to lead into new clinical therapies in ways that are hard to predict.
Yeah, I agree wholeheartedly, Deepta. As you know, as things get out of the lab and into sort of real world and various considerations, they get more focused. And, we've been focused for a long time on individual diseases, individual tissue pathologies, and that's sort of impeded our progress to really look at transformative across many diseases, common themes and pathways that really, I think, basic research is going to be very good, along with AI and machine learning, to really be able to pull some things together and be very valuable in the future.
And Dr. Dake, you spoke about some of the economic benefits in Philadelphia of some of the work that was happening. So in here, in addition to the tremendous medical benefits that CAMI will bring, can you speak a little bit about the significant economic impact that this new center will have in our state?
Sure. When we started with thinking about CAMI, we commissioned an economic impact report. And that report basically estimated that the return on investment for the state of Arizona will be 2.5 to 1. That will involve about $3.8 billion in increased revenues for the state. $480,000 in new state tax revenues, $140 million in, should have said $1 million, $140 million in local tax revenues, and about 8,000 new jobs, not obviously in CAMI, but with all the startups. And they're estimated that about 150 either new or relocated companies will be in the CAMI orbit, and with many high-paying scientific and scientific-related jobs, and that's going to improve wages by, well, they estimate $1.8 billion.
One of the things that I'll weigh in is, sometimes projections can be overly optimistic, but in this case, this is totally in line with what people have already shown federal investment in biomedical research gives you back. So we're not way out on a limb here when we talk about some of these projections.
So a question that I wonder about, and I'm sure our audience is as well, with these wonderful new therapies, will prevention still be important? Can I now just do whatever I want, knowing that it will be treated anyway?
I think what you're asking is whether you should go out and start smoking 3 packs a day. Is that what I'm hearing here? I wouldn't advise that. Again, I think I'll circle back to something I'd said earlier, which is that, many of these complex diseases have all sorts of etiologies, and the more tools we have to be able to attack them, including prevention, that's absolutely the way to go. And so I think that all of these fronts are really important to continue to pursue. And so as we define environmental factors or other lifestyle factors that are causes of disease, limiting those are going to be fitting hand in hand with some of the things that you do if those diseases actually begin.
And 30 seconds each. Final question. What would be the one key message you would like to leave our audience with today about the promise of precision medicine and immunotherapy? Dr. Dake.
I think the field is incredibly bright, incredibly exciting, and you need to come along with it. When you're in your physician's office and talking about things, ask them questions. They may not know the answers, but it'll stimulate discussion, and that's always good.
Join us. We're happy to have you enter into our field.
Wonderful. Thank you both for such a productive discussion.